My infant had a concussion. What should I know? When people hear about concussions in children, they usually picture a teen athlete. But concussions are also common in toddlers and preschoolers. In early childhood, concussions happen most often from falls, not sports. And new research shows the aftermath can last longer than many families expect. A study published in the journal Pediatrics entitled Frequency and Predictors of Persisting Symptoms 1 year after early childhood concussion looked at children 6 months to 6 years of age with a concussion. Researchers found that about 1 in 4 of these young children develop prolonged symptoms. And these lingering symptoms can matter because they may affect learning and behavior later in childhood. So what do these concussion symptoms look like in young children? Toddlers can't always explain what they're feeling, so the usual concussion symptom checklist may miss what's going on. The study authors emphasize these symptoms that parents should be looking for: behavior changes, excessive irritability, appetite changes, less social engagement, stomach aches, and increased cleanliness. If your child had a head injury and you notice these changes, don't brush it off. A concussion is just not a bump on the head. The study authors emphasize that younger children should be evaluated if these symptoms develop to determine whether treatments or other services are needed. And here are some practical tips if your child fell and hit their head. Track symptoms for the first few days and weeks: sleep, mood, appetite, play, and behavior. Report to your child's doctor that your child has sustained a head injury and describe specific changes you're seeing. Ask for follow-up as recommended if symptoms persist or interfere with daycare, preschool, or daily routines, because concussions in toddlers are real. And if something feels off after a fall or bump, get it checked and keep documenting changes. Thanks for joining me this week on the Brain Injury Insider. If you want to help change the conversation around brain injury, please consider sharing this information and subscribing. And please join me next week as we continue to uncover the hidden truths about brain injury and its impact on millions of lives.